Welcome to the Skilled MBA Case Study Series. At the Laguna Rainbow Elder Care Center, a unique challenge arises when balancing indigenous cultural practices with healthcare economics.
The sacred 4-day waiting period for a departed spirit's transition conflicts with Medicare's need for efficient bed turnover. This tension highlights the struggle between respecting cultural traditions and maintaining financial viability in healthcare settings. At Laguna Rainbow Elder Care Center, Director Larry Curley faced a dilemma balancing cultural traditions and healthcare economics. Local tribes observe a 4-day waiting period for spiritual transition, conflicting with Medicare's need for efficient bed turnover. This tension highlights the challenge of respecting cultural practices while ensuring financial sustainability in healthcare settings. The Pueblo tradition emphasizes a sacred waiting period to honor the spirit's journey to the afterlife. Zuni beliefs hold that 4 days ensure a proper spiritual transition. Hopi customs require the room to remain vacant, respecting ancestral beliefs. For the Jicarilla Apache, this cultural imperative is essential to honor the deceased respectfully. This case study draws from ethnographic studies on Native American end-of-life rituals, policy documents on Medicare/Medicaid reimbursement, and academic analyses of cross-cultural ethics in healthcare management. These sources provide a comprehensive understanding of the cultural and financial challenges faced in balancing traditional practices with modern healthcare policies.
Larry Curley faced a complex decision balancing cultural respect and financial viability. Tribal customs required a 4-day vacancy in a deceased's room, conflicting with Medicare's reimbursement model tied to occupancy. Curley had to negotiate with the New Mexico State Medicare office to secure a culturally sensitive reimbursement solution without compromising the center's financial health. Healthcare leaders face the challenge of respecting indigenous traditions while ensuring ethical responsibility. Balancing moral obligations to both community and institution is crucial. Financial constraints add complexity, requiring operational sustainability within regulatory frameworks. Navigating these elements demands a nuanced approach to align cultural sensitivity with ethical and financial imperatives. Healthcare leaders face ethical dilemmas in balancing spiritual traditions with operational sustainability. Federal reimbursement rules often overlook indigenous ceremonial practices, creating tension between cultural respect and regulation. Effective stakeholder management is crucial, requiring alignment of tribal elders, families, staff, and state Medicare officials to navigate these complex challenges. Medicare reimbursement policies often link payments to bed occupancy, posing financial risks during vacancies. Indigenous ceremonial practices, not recognized by federal rules, exacerbate this challenge. Healthcare facilities must find innovative solutions to balance financial sustainability with the respect and integration of sacred cultural traditions, ensuring both economic viability and cultural sensitivity. Healthcare management students will explore operational challenges in culturally diverse settings, focusing on balancing financial viability with cultural sensitivity. Business ethics students will delve into moral decision-making within complex organizational contexts. Cross-cultural leadership will address navigating cultural sensitivity in management, while public policy students will analyze policy implications affecting indigenous communities. Explore how indigenous cultural practices intersect with healthcare economics, highlighting ethical trade-offs when financial and spiritual priorities clash. Evaluate negotiation strategies between government agencies and culturally distinct communities, aiming to formulate culturally competent solutions within regulatory frameworks. Healthcare administrators must balance cultural traditions with financial imperatives by fostering dialogue and understanding. Policy innovations, such as exemptions, can support spiritual practices while ensuring elder care centers remain solvent. Effective negotiation and advocacy are crucial in safeguarding indigenous cultural rights within federally funded healthcare programs, ensuring respect and compliance. Tribal elders emphasize the importance of honoring sacred traditions, even if financial implications arise. Families expect cultural practices to be respected during the grieving process. Healthcare staff require clear policies that balance cultural sensitivity with operational needs. Medicare officials must ensure compliance with federal reimbursement regulations, highlighting the complexity of integrating cultural respect with financial and regulatory frameworks. Cultural competency is essential for healthcare leaders to build trust and deliver equitable care by respecting Indigenous traditions. Adapting state and federal reimbursement structures to diverse cultural contexts is crucial. Ethical decision-making in leadership demands creative negotiation and advocacy, extending beyond financial considerations. This case highlights the necessity for culturally responsive healthcare policies that respect Indigenous traditions while ensuring institutional sustainability. Healthcare leaders must innovate to bridge federal regulations with cultural needs. Success relies on collaborative negotiation among healthcare administrators, government officials, and Indigenous communities, urging us to rethink healthcare delivery to serve diverse populations with dignity and respect. For further inquiries or to access additional educational resources, contact us at support@skilledmba.com or call +9 187 553 00795. Our team in Modinagar, Uttar Pradesh, is dedicated to supporting your learning journey and providing comprehensive insights into culturally responsive healthcare policies.